Welcome to the live checkup. This is where we sit down with Dr. Asante Le Blanc and ask all the possible questions we can when it comes to our health and care. Let me just tell you this first off. Dr. Asante Le Blanc is the medical director and owner of Victoria Clinic, your home for holistic health care in Trinidad and Tobago. Victoria Clinic is located at 54 Galley Street in Woodbrook. Dr. LeBlanc is a medical doctor and certified medical herbalist. She is an integrative health care practitioner, bringing together the eastern and western branches of medicine so as to better guide patients on their path to optimum health. She's also a certified clinical densitometrist, specialist in diagnosis and treatment of osteoporosis. At Victoria Clinic, services offered include medical consultations, traditional Chinese medicine consultations, acupuncture, medical herbalism, blood tests, electrocardiograms, lung function testing, and Dexter bone density testing. You can contact Victoria Clinic at 622-2221 or 622-0683. Follow them on Facebook, Victoria Clinic, or Instagram, Victoria Clinic_Trinidad. Website, www.victoria-clinic.net. This is the live checkup. I'm JD. Now, let's jump into today's conversation. Hey, good evening, guys, and welcome back to the live checkup. I'm JD, and of course, you see Dr. Asante Le Blanc right there sitting with me inside another conversation right here pertaining to health and all the things that we need to know. And we've had various topics in the past. If you really don't know about our program, trust me, just go in the history and check out the episodes posted in the past on this particular channel. And also you can check out our websites. There are posts there as well, even our Facebook pages too. So we'll give you more details on that later on. You would have heard in the bio a little bit about the doctor in studio with me, the virtual studio, Dr. Asante Le Blanc. So right now, though, we certainly thought it would be best to have a very pertinent conversation in this world we're living in where COVID seems to be just around us all the time. But before we dive into the conversation, got to say good evening to you, Dr. Asante Le Blanc. How are you doing?
Good evening, JD, and good evening to everyone. I am doing excellent. I took a little break, so I'm rejuvenated and ready.
Well, yes, you did. Yeah, well, it's deserving. Huh? You do need that sort of break from this crazy world we're living in. COVID-19, the coronavirus COVID-19. This is exactly what we're going to talk about again. We have spoken on this before a few times, didn't we? We did a few episodes just breaking it down.
Yeah,
But
we did about 2 or 3 episodes
yeah,
on it when it started. Yeah.
yeah, but the numbers have started to increase in Trinidad and Tobago, and it's no laughing matter because there's some things that still need to be readdressed, if I can say that, because obviously some persons are not practicing or doing what we should. And then we have other situations, of course, with the border being the question mark of those persons that may be coming in. There's a lot to take in right now. And well, we just got to have this conversation because I see the numbers increasing, Dr. Asante Le Blanc, and I'm a bit I don't want to say anxious because we spoke on anxiety some time ago, but I'm a bit extremely concerned for myself, my family, and those that I love. How do you feel about it?
JD, I would like to say that I am concerned. I do have a bit of anxiety
Ah,
in terms of it being healthy anxiety because I as a physician, a mother, and a caregiver and a friend, I think it's now put me back on high alert. So we do have established community spread for COVID-19 in Trinidad and
yeah,
Tobago. So that's now declared. We know that. We're no longer having sporadic cases, as the CMO mentioned. We are now in the status, according to WHO classification, of cluster cases. What does this mean?
yeah,
It means that we have community spread. And from that, when we do the contact tracing, we're seeing definite clusters related to that contact. So it's no longer just popping up and you're not sure how you got it. So we're seeing definite geographical and contact unity and connecting the dots, so to speak. If you remember the map that they put up the other day
yes, I
with the
saw that.
one person and all those arrows, that would
Lines
have made
that were
you
going. Yeah,
that would make you stay home immediately.
yes.
Um,
Ah,
but I think the biggest worry is that I think over the past, and so by the time we're on tonight, um, we'll probably have more
Yeah,
clusters, but we now
unfortunately.
have 8 new clusters for investigation. And that is concerning because the reason the Minister of Health was trying to flatten the curve and warning us about this is because of two things. First of all, to save lives,
Right.
obviously, and to protect against transmission of this deadly virus, but also because of our
Okay.
human resources in the healthcare system. So
Mm-hmm.
now we have a parallel healthcare system. And so this is going to be a hard time for all healthcare workers and for the government, for all of us involved.
Such and everybody else. Yeah. One of the
Yeah.
things I was saying most recently on air, meaning radio, for those of you that are looking on, I was just saying I was really annoyed and pissed off. Yes, we all have reason to be anxious at this point in time, but I was really angry because I was saying for those that are not practicing the simple guidelines that have been given to us to try and keep the curve down, and we see the curve is rising. Now, there are many, like I said, there may be many reasons why the numbers are increasing, but we have practices to apply. I really just got livid when you think about, we keep forgetting persons like yourself, nurses, doctors, admin staff who work within the healthcare system, who are, as we call, the essential workers. And they are human as well. And they now have to go out to care for these numbers that unfortunately just keep rising. So we have to think about that as well when we go about our business, when we don't want to wear the simple mask, we don't want to sanitize, all these simple things. And I think a lot of it has to do with not wanting to do it, has a lot to do with pride, because the mask is just a little bit, or difficulty in some cases. But you think about some person saying it's not fashionable. You see young children doing it as well. Not when I say young teens. School most recently was open for some, and we see some of those schools that have been closed as well. But it's just so much, and you're seeing so many people not practicing. So I want you to speak on those things later on. What are the things that we need to do according to the CMO, according to WHO?
Uh,
But if we could,
according to, yeah, go
but
ahead.
if we, but if we could start at the top, and you can just, maybe someone is visiting from Mars. Can you give us the definition of COVID, the coronavirus, COVID-19, and what really happened?
COVID, COVID-19.
I know
So
you're laughing, but it has
COVID-19,
to be someone visiting from Mars who doesn't know about it, right? So,
COVID-19 is a novel or new coronavirus.
right,
It was discovered in 2019 in China. Coronavirus is a type of family, so it has a crown, as Dr. Trotman explained to us in the
right,
earlies, and that is its pathogenic factor. Um, the coronavirus is a novel virus in that the disease it causes, while it's a flu-like illness,
right.
it has a little more um, deadly effects, dare I say, than the regular influenza virus that we are accustomed to seeing on a seasonal basis. So when COVID-19 came out and the disease came about, I remember a lot of us were saying and equating it to the deaths, for example, in the US, the
Mm,
deaths by the regular flu every
right.
season, and saying, this amount of people die by a flu every season. So, the COVID-19 is just another flu virus. Well, it's proven that them all wrong. We've had too many deaths.
Mm,
Um, the USA has hit over 152,000. Um, we're gracious in the Caribbean, where we've had very low numbers when it comes to deaths. This virus is also mutating quite rapidly. This virus is not producing any long-term active immunity. What does this mean?
yes, please.
When our body comes into contact with a bacteria, a virus, any pathogen, any foreign um, animal matter,
Mm,
such as a bacterial virus, it will start to mount an immune response. That immune response includes antibodies. So once our antibodies are created against that disease, we have now active immunity. What does this mean? It means that in most cases, when our body comes into contact with it again, our body has memory cells and says, oh, I remember
I
you.
remember.
And that immune response keeps mounting and getting stronger as you come into contact with the pathogen. There are some diseases, such as chickenpox, that you get once and you have eternal immunity. So you should not get it again. Now,
Right.
it's very rare that you can get chickenpox more than once. So there are different viruses and bacterial infections that you may have perpetual immunity, but the majority of them, we form active immunity and our body protects us. Then we have vaccines that protect us because the vaccines have been um, formulated using either inactivated viruses or live viruses or bacteria to produce again prolonged immunity. So this includes your entire mandatory, or I should say recommended, immunization schedule from birth. So
Right.
tuberculosis, hepatitis, Haemophilus influenzae, tetanus, diphtheria, um, mumps, measles, rubella. Those are usually the pathogens and the diseases, and smallpox as well, that we will vaccinate against. COVID-19 is different. We do not have a vaccine. It spreads rapidly,
Hmm.
and we have seen very simple practices to deter or detain transmission. And those simple practices will decrease immensely your chance of being infected. Our at risk groups are there, and they include the elderly. They include, now we're seeing the younger generation.
Yeah.
We have people in their 30s that are now in the ICU in the developed world, which is the USA and its entities. We are the at-risk groups include people with lung problems, asthma, COPD, emphysema, bronchitis, um, pulmonary fibrosis, cancer patients on chemotherapy, on radiotherapy, or have just finished their therapy, or survivors who have just finished their therapy. We have patients who are diabetic, hypertensive, cardiac patients. All of these are at risk groups for COVID 19 infections. Meaning, if you get infected, the risk of being complicated and having a moderate to severe infection is increased because you're in an at-risk population. COVID-19 is I would like to say it's a great impersonator, because we've had Sahara dust, we've had the regular flu, we've had everything coming in, and therefore the signs and symptoms are very mild and not even detected almost sometimes in our population. What are the symptoms?
Okay. Go ahead. I was just gonna say maybe that's why persons who would have had it didn't realize that they did have
But
it.
But the thing is, we said to everybody, the ministry stated,
Yeah.
if you have a
If
flu-like illness or signs or symptoms,
stay.
stay home. Call the helpline, call the hotline, or if you're really not feeling well, go to a health center.
Yeah.
This did not happen. It did not happen. It broke down. And I can tell you it broke down because even as a physician, we were frustrated because you never knew what was coming in. You didn't, you can't determine from just looking at it, is it COVID? Is it not COVID? You understand? It was something where even now when patients come into me, I'll be masked, I'll be
Yes.
gowned, I'll have my face shield. Yes, I'm on high alert, but I still don't know. I still don't know because the symptoms are mild to moderate. So a lot of the cases that we were seeing, and this is another issue, JD, we've had asymptomatic super spreaders in our community. So, I think right now what we have to do in Trinidad and Tobago is accept that yes, we have community spread. That's number one.
Yeah.
Number two, remind everyone, and don't be afraid to tell someone, physically distance from me, please.
Hmm.
Don't be afraid to tell someone, can you kindly put on your mask properly before you enter my establishment?
Of course.
Don't be afraid to tell someone, can you wash your hands or sanitize your hands? These are things that if we are not our brothers and sisters keepers now, we are going to live to regret this decision.
Before you go into the symptoms, Dr. Asante Le Blanc, you just mentioned something that we hear all of the time. Can you just get a little more deeper into it? What is a asymptomatic person?
So an asymptomatic carrier is one who
Carrier.
has no symptoms, none whatsoever, but has the active virus. And therefore, the cough and the sneeze, which is the respiratory droplets, will be infected and therefore can infect others around the person. If
Yeah.
they're not wearing their mask, if they're not sneezing and coughing into the crook of their elbow, if they're not washing their hands, you, all of these things. So
So
an
that's
asymptomatic
why
carrier.
it's not just for persons who are ill to wear the mask, you're saying, because an asymptomatic person may have no signs at all, but it's safer for him or her to wear the mask just in case.
Exactly. So the mask does two things. It protects you, the person, from transmitting if you are sick.
Right.
And to a lesser degree, depending on the type of mask, it protects you from being infected. So the type of masks that are worn, the cloth masks, the bandanas, all of those masks are good because they protect you from transmitting,
Yeah.
and they give you some protection from being infected. For the medical staff, such as myself and nurses and those working in hospitals, the surgical masks protect us even a little more. And if we are going into a really suspicious situation, the N95s and the KN95s and the N95 masks give us better protection from being infected.
Yes.
But that does not mean we will not go into a situation if we don't have it. If we have a mask, be it a surgical or an N95, if the need arises, we have to make a personal decision.
All right. So that's just a little bit on mask, and I know you want to talk a little bit on the shields in just a bit because I saw you having a conversation with one of our mutual friends some time ago about the shield and the mask because I know everyone is trying. Some persons find it a little bit difficult to use the mask, so they would prefer the shield in some cases. But I know there's also a conversation pertaining to that, so you can touch that in just a few minutes. But are there persons who you would suggest should not or won't be able to use the mask? I'm thinking about asthmatic persons as well. Those are my thoughts there.
No, I'm very sorry. The asthmatics, all of them need to use the masks.
Right.
The children below 2 years of age will not use masks.
All right. So
We can't.
everybody.
Everybody use a mask.
All right.
Um, and JD,
Mhm.
I find the masks uncomfortable.
We all
I
do.
wear a mask. I wear a mask for at least 8 hours a day. I take my mask off to eat and to drink water and my coffee. You
Mm-hmm.
understand? So it's a slight discomfort, but then I envision my lungs with COVID, and I think, well, I should probably just wear this mask because I really don't know if I can handle not being able to breathe for too long. That will throw my entire central nervous system into overdrive. You understand? I can't handle being away from my family. I
Yes.
can't handle,
Understood.
and this is thinking worst case scenario, me getting a moderate to severe infection where I'm in a hospital and my family can only see me through a phone. So these are things that I think about as a mother, as a wife, a friend, a daughter, a granddaughter, as a woman, that I can do much more if I stay alive.
Yeah.
And I think we have to make these decisions. And unfortunately, in Trinidad and Tobago and in the Caribbean, I think we were so blessed in Trinidad with no infections for over 2 months.
Yes.
So to to hear that you have this rise in infections, the first thing that comes to our mind is, oh my God, the bars are going to close, the restaurants are going to
Priorities.
close, the
Priorities of the
beaches
thing.
are going to close. So, and don't get me wrong, I thought the beaches are going to close because that was the one thing you were able to do with your family.
Yeah.
and relax and, wind down and re-energize and rejuvenate. But at the same time, I prepared my children from when I saw the cases increasing. I said, you know where this is going.
Mm.
Whether or not the government locks me down, I am on lockdown. You are all on lockdown. There is no, you have to make a
Running about.
decision
Yeah. 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 Yeah.
because you go into the grocery, you're not physically distanced. They try their best, but you're not. You go into the pharmacies, you're definitely not socially distant. You go into a restaurant, you're not socially distant. You're not physically distant because they can't make money if they separate a table by 6 feet.
So
You
obviously,
have to take
practice
off
is not working.
you have to take off your mask to eat
Yeah.
and drink. How are we doing it? So, we have to make personal decisions.
Can you speak on the shield? Because a lot of people are starting to use those. You see it whether you're walking the street, you see people using that versus the mask. How do you feel about that?
The shield protects your eyes. The shield without the mask has shown that we do have an increase in infection in New Zealand. Everybody used shields in a certain population, and there was more infection.
Wow.
So that was documented somewhere. Of course, I was online reading that at some
Hmm.
point.
Hmm.
So you should use the mask with the shield. We
Mask.
use the shield in the medical practice because it helps us, especially if for our eye protection. We may even have to add goggles to the shield if it's a highly suspicious case. So the shield alone is not fully protected. And then you remember you have to sanitize that shield every time because if respiratory droplets are on that shield, it can infect you because you touch the shield and then you go and then you might rub your eyes and then go, oh my God, I didn't wash my hands. And boom, that's it. So it's important to understand how to take off a shield, how to deal with these masks, how to take them off, put them on. What do we do? How how to be hygienic when you take them off and put them on. Very important.
And that's something I always think about, being hygienic when you're taking them off. Most recently, I don't know if you would have seen on my page, I posted, don't forget to sanitize the sanitizer bottles, because everything is, just we're touching almost everything. But I think the main thing is to try to avoid touching our face, which we do so many times per day, we don't even recognize that. So that's,
JD, it's so hard.
yeah,
It is so hard
yes,
to remember I shouldn't touch my face.
yeah, it is.
And
Very,
and it's a different lifestyle. But I think that we can maintain positivity.
yeah.
I think we can maintain our dedication to health. I think we can do better as a population in Trinidad and Tobago. I don't think it's all for naught. I think this is the junction of making the correct decision, knowing if you really need to go on a line of 10 people or not, knowing if you really need to go home or stay home, sorry, or go out.
Hmm.
Go to work, go home. Remember to take off your clothes at the door, sanitize, go
Yeah.
up and bathe, have that shower. Exercise, keep eating healthy, get that sleep, maintain your body in a healthy situation and position so that your immune system is functioning at its optimum and therefore able to help you if confronted with a virus.
So we will talk about some of those things that we can do to, I know you hate when I say it, but assist the immune system in some way. But a few minutes ago, you mentioned symptoms. Can you just touch on some of those? Of course, we know it's these flu-like symptoms, but is there anything else that we need to be looking at? Some
So
say
the
lack of
headache,
taste or
headache,
smell. Hmm. Hmm.
dry cough, fever, nausea, vomiting, diarrhea, body pains, fatigue, extreme fatigue, loss of smell, loss of taste, shortness of breath, sneezing are all signs and symptoms of COVID 19, infection from COVID
That's
19.
a lot.
If you have at least 2 to 3 of those symptoms, you need to not leave your house, call your doctor or call the hotline and let them know. Remember, the minute you're infected, at least by day 4, we expect symptoms to show up.
Right.
Think about it, but the thing is, you may have come into contact with an asymptomatic carrier.
Mm.
And important to remind our viewers, JD, and our friends, don't lie if they call you for contact tracing. That makes no sense. Do not lie. Answer the phone. Let's do our part as individuals in a nation. Let us help the
Mm.
government.
Yeah.
Let us help them because it's only going to help us. So it doesn't make sense to dodge the calls, to lie about your symptoms. It doesn't make sense.
I'm surprised persons are doing that, but I did hear that conversation. I'm also very disappointed that persons are making it political. Obviously, we are in the week lead up to the elections here in Trinidad and Tobago. COVID has no respecter of which party you choose. This is absolutely more serious than anything else right now. So it is quite disappointing, to hear that persons are telling tales in terms of not identifying their location or who they were in contact with. I want to say this. One of my callers on radio suggested this, and I thought it was absolutely beautiful, where we should start journaling, just journaling where you would have gone during the day, because sometimes we forget that we passed through Pennywise or we had stopped by the pharmacy. These simple things that can possibly assist just in case. That can be a way to just journal your daily runnings. What do you think about that?
I think that's a nice idea. I personally can't do it. I think that might make me more nervous. It's like me doing a food diary to lose weight. I do it for a week and then I go, no, I think I'm eating too much or too little, and that's the end of that. But I try to do it. I
Right,
really think it's a good idea, but again, I don't want people to go into a state of OCD, nervousness,
right.
hypervigilance,
I hear
which
you.
can then cause other problems.
Anxiety, which you spoke about not too long ago, but
Yeah.
it's not very anxious. So let's talk some more about COVID-19. By the way, this is the live checkup. I'm JD. This is Dr. Asante Le Blanc. We're speaking about most recently the number of cases that have been increased in Trinidad and Tobago pertaining to this virus, this pandemic in which we are living in, just like everyone else in the world. So we are not immune to that. We too are going through it. We did pretty well. And I want to say that in terms of not high numbers, but unfortunately, we lost 8 persons so far with this particular virus. So that in itself is very difficult for persons who are no longer spending time with that loved one who died as a result of that disease, that virus. So we are hoping for no more numbers in terms of the death toll. But I want you to really explain to me, Dr. Asante Le Blanc, and our viewers, how the 14 days quarantine really works. What's happening during that time? Why 14 days versus 24? I'm just saying, because I have a friend in Miami. She has it. I think she just got out of her 14 days of quarantine. And it was really just like a mini vacation for her, thankfully. No symptoms or anything to speak about. But why 14 days? What's happening during the 14 days?
So the 14 days is the period where we're seeing the majority of the appearance of infection. So
Mm-hmm.
14 days from contact with the infected person. So within 4 days, symptoms should apply, but up to 14 is kind of the benchmark for us to see signs and symptoms. However, I should caution that it can be at least between 21 and 35 days in some people.
Say that again.
So it can be between 21 and 35 days in some people. So
Oh,
14 days, but the majority of the population, 14 days is the time in which we expect to see symptoms if you have been infected. So that's why we do the 14 days. 14 days, if you were in contact with an infected person today, then
mm-hmm.
you self isolate. So there's a difference between quarantine and isolation. Self isolate in your house. So this means if you're living with people and especially at risk relatives, you go to your bedroom if you can and
Thank
you
you.
do not come out. You need to isolate. Now, if you have the infection, this is why we're taking everyone into quarantine and into the public system because there you are monitored, your symptoms are monitored, you're tested, and we can quarantine you properly without possibility of you saying, oh, it's just to the corner shop. I have on my mask, I'll be okay. You would have spread the virus.
Right.
So 14 days is the time we need to see if symptoms appear after you've been in contact with someone who's had um, COVID-19 infection.
Right.
Also, if you have a flu-like illness and you call in sick to work and you, let's say 2 days you've had that flu-like illness,
Hmm.
the reality is you should stay home for 14 days
Okay.
because that allows us to see if it's developing into a COVID-19 infection, and it's just that it's a very mild infection.
Okay. So, Dr. Asante Le Blanc, let's talk about some of the things we can do to make ourselves healthier to try to build the immune system in some way. What are some of the things, whether you're speaking medicinally or as you usually do holistically in terms of
Well,
herbal?
JD, I start always with our lifestyle. It's about eating a healthy, balanced diet. I know times are rough. A lot of people have lost their jobs, their salaries have been cut. It's rough times, but go to the market, buy your vegetables, your ground provision, eat your fruits that are in season. Please, this is very important to keep your body healthy. Exercising is important, at least 3 to 4 times a week. Cardio exercise, aerobic exercise, which is running, walking, swimming, jogging, all these things. Try and do it in your house if you can, because we're still on a different level
Yeah.
right now of infection in Trinidad and Tobago. Um, Sleeping properly, ensuring a proper sleep cycle is very important in the holistic view of how to keep your body healthy, to keep your stress levels down, to help your body repair and rejuvenate during the nighttime. Then we come to what can we do? So vitamin C, either from the fruits or taking vitamin C on a daily basis, drinking lots of water,
Hmm.
using herbs such as echinacea or astragalus will help you with your T cells. It can help support your white blood cell count and your white blood cell production of antibodies. Using herbs such as elderberry or sambucas, um, lemongrass, ginger, turmeric, cinnamon, Spanish thyme, garlic, onions. Those are all very beneficial, especially if you start with a fever, not feeling too well.
Hmm.
You can use those in the earlies to help you with fever and chills and generally not feeling well. Remember to even eat. So if you feel sick and you don't want to eat, you get a sore throat. We forgot sore throat in the symptoms. I'm very sorry. You get a sore throat, you're just not feeling well, you don't want to eat, take some soups, bean soups, fish broths, dal, anything like that to keep that body nourished so that the immune system is able to work at its optimum.
Okay. So there's just,
I I
go ahead.
use I I guess I should tell you that I have my formula which is ready for the road,
Hmm.
and lung and viral support, which has a lot of a blend of herbs, which I use to help whenever I get any kind of viral infection. But I think look in your garden, you're feeling sick, use whatever you see, lemongrass, fever grass, zebra peat. You can find stuff in Victoria Clinic as well. There's no shame in that. Everybody knows Victoria Clinic has um, herbs and formulas. And please note, this is not being purported as a cure.
No.
It is something to support the body from a holistic standpoint in conjunction with your diet and your exercise. I'm very cautious when I recommend these things, JD, because I know we're now at a state of anxiety and clutching at straws, but that will not help us. We have to just be calm, drink your teas, drink your mint, your fever grass, not too much mint if you have acid reflux. Use your honey if your throat is sore. It helps with regeneration of the throat mucosa. Sorry about that.
No problem.
Use your honey with ginger and cinnamon and turmeric. And just overall, JD, if there are any questions, I mean, we can answer questions tonight as well. You heard about some herb, you heard about something, your grandmother used to give you something. More than likely, I've heard about it as well, and we'll be happy I'll be happy to explain it to you. There's some herbs that we cannot use or should not use. We've discovered that they have toxicities to the
Right.
body, but in prolonged time and for prolonged use. But JD, the cornerstone is a healthy diet, exercise, sleeping, and using the herbs that we just mentioned, and eating what's in season and what is native to us.
And that's basically it. Now, before we get ready to wrap up our conversation, I don't know if there's any other things you'd like to touch on. I mean, COVID is one of those conversations. COVID-19, the pandemic, is an ongoing conversation. It's so fluid. So, of course, there's never any concrete data when it comes to anywhere close to being. I hear so much talk about the vaccine, and that in itself is a process. So what can you say to us as we get ready to wrap up this conversation in connection to this dreadful pandemic we're living in 2020? What a year 2020 has been, huh?
It's a gift that keeps on giving. It's a gift that keeps on giving. I am very sorry. I'm usually an optimist, but 2020 is riding that last nerve. It's taking me to places I never knew existed
So
in
true.
my mental thoughts. I think 2020 is here to see how resilient the human race can
Yeah,
truly be.
yeah.
Um, be kind, JD. Let's be kind to one another. Let's not be fearful. Remember, if I tell you, please don't smoke next to me, I'm just defending my right to health and immunity. Um, if I tell you, please, let's be physically distant, let's do it. Don't go overboard. If
Mm.
we're a family going to Tobago, we can't physically distant at the airport because in any case we're a family. So use your brain. So think about these things. So don't just, if you see me put sanitizer on my hand, don't tell me I can't enter a shop until I wash my hands with your water and your soap and
Listen,
touching your dirty pipe and using
listen.
soap that may have an allergy on my hand. There is some logic to your, just breathe. So
No,
do you understand why 2020 is riding my last nerve? Do you understand what's happening?
I
So
think you did the same. Hmm.
I'm saying this to you loud and proud. Get your mask on, put it on properly, cover your nose and your mouth. You go to a shop. You know what I do? I take my sanitizer out in front of you. I put it on my hand. I said, here I
I
go,
do that.
sanitizing. I'm entering because there's an option. Because I don't know if your soap may affect my skin. I don't know if I really feel like washing my hands when I just washed it 2 minutes ago. So I have to look after myself as well.
Mhm.
So I am not telling you I'm not going to wash or sanitize. If I have gloves, I understand why you don't want me to wear gloves in your store. I could sanitize the gloves in front of you again, but let's not go that far. Use your mask, people. Wash your hands for at least 20 seconds. Remember, wash in between your fingers, wash under your nails. Cut your nails, ladies. There's no time for glam jam. Do not be putting on all those long nails right now. Wash your hands, wash your hands, wash it properly and dry your hands. If you do not have access to soap and water at the time, or like me, you may have washed your hands over 50 times that day, then you use your hand sanitizer, at least 70% alcohol based sanitizer on your hand and go about your business. Please use your mask, wash your hands, physically distance from the person. If you're coughing or sneezing, into the crook of your elbow. Do not leave your house if you're sick. Make
Mm.
that call to the hotline or to your physician. Be your brothers and sisters keepers right now in the time of COVID-19. You're supposed to do it all the time, but especially now.
You know,
And
go
let
ahead.
us not be aggressive. Let's not be aggressive and lose all sense of logic. Let's
And
try and remember
something
some
that
kind of logic.
something that really just pops into my head. By the way, I do the same thing like you. I walk with my hand sanitizer in my, and I get to the door and I sanitize in front of them because I'm using yours. But just now you just said not just now, you said it a few minutes back about, if you're sick, and some persons I keep hearing it about, visit the health center or whatever it is. I just feel like if I'm showing signs, you should just stay home and, as you say, make that call, or contact your GP. But I have heard of persons who um, were maybe showing symptoms like they're sick or something like that, and the boss says, "Now you've got to go to the health center and get a pass to say that you're good to go." And I feel like, am I wrong in thinking that's not how it should be done? Because if that person does have the flu, literally, that's, I guess it's safe there. But let's say they do have COVID-19, and of course they are not even aware of it, but they're seeing these signs and symptoms, and my boss or whomever it may be is sending that person to the health center. Isn't that kind of chancing it?
Yes. So
You stole.
they
You can tell me what's wrong.
because it's a difficult situation. So if you're at work and you're feeling sick, then you should go to the health center, the closest health center. The health center is set up in a way that if it's a flu-like illness, then you don't go in with the rest of the crowd. It's supposed to be
It's set up like
segregated,
that. Okay, good.
right? And then the physician and the nurses will review you, and they will determine, are you an eligible candidate for a swab or not? And then they may give you a sick leave and send you home and tell you what to monitor
Okay.
for. But if you're not comfortable with that, then you should call your physician. After that, let them know, and your physician will guide you along the way.
Yeah.
But however we look at it now, there is private testing. So private testing is available, and it's for a hefty sum, but
Yes, I heard.
It's available at St. Augustine Medical Laboratory and also St. Clair Hospital via the same lab.
And this has been approved by the CMO and the entire team.
Approved by the entire CMO Ministry of Health.
Okay.
So, I mean, there's that option. And then, as they said in the last few press conferences ago, Dr. Nadram said that they're hoping to bring on board the antibody test, which will allow us to do more in office to see if you've been in contact with COVID, where you are from an infection standpoint.
Okay.
So, I mean, things are there, but in the meantime, these are very simple practices, as Dr. Trotman quoted as well on Friday. Very simple practices to keep yourself and your friends and family healthy. I know it's tempting. I know it's tempting to go down the islands and then come back to work the next week. But remember how many people you're mingling with, and then where you're going to work. Remember your individual circumstance and make wise decisions. Think about it carefully, and truly be honest to yourself and those around you.
I do want to say this before we wrap up. Of course, your questions are always welcome, so I hope you would have put your questions there for us. And this is a pre-recording, and I've got to say this because, by literally, you never know how the numbers can go. So currently, we are sitting somewhere at 180 by the weekend in terms of persons confirmed, and we just have to wait and see, because occasionally we have press conferences during the week, and data and info may change. So just in case it is not mentioned here tonight, don't think, hey, we're going to talk about it. Again, we're just saying that this is one of those, because of both our schedules. We recorded this on Sunday, for you guys. And of course, we're airing it on Thursday. But the content, of course, is still the same. But I only say that.
If the content if it changes drastically between now and Thursday, we'll be online in any case.
Yes.
And be there to give you any updates as well. So, I mean, don't think that this is, and COVID is like that. It's a very dynamic situation.
That's
so, let's just be safe, everyone. Please follow the practices. Follow Victoria Clinic. We will put out different things on Facebook and IG in terms of how to stay healthy during COVID-19. Send us your questions, send us your topics, and JD and I will be happy to chat some more. We enjoy our weekend chats.
And yes, we do. But by the way, I created an email address. You can send that email to me if you've got maybe an idea for a conversation that we can have together, the doctor and I. So it's jdsocial868 at mail.com. I should also put it on the screen somewhere here. So you can certainly contact me there. So maybe you've got an idea for a conversation that you need to find out more details on pertaining to your health. We do that. This is my YouTube channel, of course. So click like and share. And you heard the doctor speak about, her platforms before as the way you can certainly connect with her and the crew at Victoria Clinics. So until we connect again, Doc, I do thank you so much for your time as always. And thank you for doing what you do. I know it's a dangerous world, especially for those of you that give of your time and your energy, but we thank you for it.
We signed and swore to that Hippocratic oath. So it's indeed my pleasure.
Thank you very much.
I really appreciate your time and effort on this as well, and allowing us to share information and breaking down anything when it comes to health.
All right. So thank you so much. And join us next week inside another conversation. You never know what it's going to be. So don't forget to send us an email just in case you've got any ideas of what we should be talking about. All right. So I'm JD, Dr. Asante Le Blanc. Thank you
so
much.
Good night.
Have a good night.
You too. Bye-bye.
And that's it. Another episode of The Live Checkup with Dr. Asante Le Blanc. This is where I say to you, thank you for your time. Thank you for listening. Thank you for the questions as well. You help me do my job even easier. And of course, it's always good to have Dr. Asante inside of our world virtually discussing some of the very important topics pertaining to our health. Now, if you've got that topic for a health discussion with Dr. Asante Le Blanc, don't hesitate to connect with us. In fact, send that email to jdsocial868@mail.com. Yeah, and we'll certainly put our heads together and bring forward another one of the episodes with you in mind. So don't forget, jdsocial868@mail.com. Check out my website as well if you're looking for any voiceover talent or maybe a host for an event, whatever it may be. Check it out, www.jdmedia868.com. You bring me